Many people that have had COVID are battling with what doctors call long COVID. Today, our Amy Johnson sat down with long COVID researcher Dr. Ashok Gupta to talk about possible treatments.
Are we already seeing long COVID effects from Omicron?
Yes, so at our clinic, we're beginning to see people who were infected around December who are beginning to show signs of the infection lingering. So we do predict that there will be a kind of avalanche of long COVID cases over the next few months.
And what about children? Are you seeing it in children as well? And how are you treating them?
So at the moment at our clinic, we don't specifically treat children, but we do have people coming to us who have children with long COVID, and they can obviously interpret our neuroplasticity program and adapt it for the children. There is, it's quite a lot of evidence that perhaps not as many children as adults go on to getting long COVID, or certainly it doesn't linger for as long because children's immune systems tend to be more flexible. But certainly anywhere between 5 to 20% of children go on to having lingering symptoms for at least 8 weeks.
Now, we've heard so many different symptoms about long haulers in the past. Can you explain? And I have to say, I actually had COVID. I had a breakthrough case that was pretty bad. And I often said, I feel like I have COVID brain. And I couldn't remember a lot of things. I just felt a little slow. Can you give us an idea of what really happens with the brain when you have this kind of long haul experience?
Sure. So at our clinic, we have this hypothesis that when you contract COVID-19, most people are able to fight it off and get back to normal. But in some particular cases, if the immune system might be strained for some particular reason, or let's say someone may have overdone it for whatever reason, then the immune system has an altered response. So even once the COVID-19 infection has disappeared, the brain has actually changed. There's been an impact on the unconscious brain. And from at that point onwards, the brain is responding as if the infection is still present.
At what point do you say, okay, now I need to go get some help?
I would say after around 6 to 8 weeks, if a person is still experiencing symptoms, they're not able to do normal daily tasks, then definitely they should see their doctor again and tell them, look, it's been lingering for this period of time. And obviously, if it starts getting towards 8 to 12 weeks, then that defines it as something more serious. That's probably more likely to be long COVID versus a normal period of convalescence from a virus.